A little bit about me. I'm Delegate Cherry. I represent what will be the newly drawn 74th district here in Virginia. Encompasses all of Colonial Heights and part of Chesterfield County to the southern tier of Chesterfield County. In terms of history, I originally started in local government. I was a city councilman with Colonial Heights. I served a term there, was reelected to my second term, and then as soon as I was elected, I started running for the House of Delegates due to the retirement of former Speaker of the House, Kirk Cox, who was the delegate that preceded me in this district. And so that's kind of the history of how I got to where I'm at. A little bit about me. I'm an Air Force veteran. I served 20 years in the United States Air Force. I retired back in 2011. My current job is I'm a pastor and I'm an educator. I run a Christian school as my day-to-day real job, so to speak, since we're a part-time legislature here in Virginia. Married to my beautiful wife, Teresa, for almost 32 years, 2 great kids. My son is married, so I have a wonderful daughter-in-law and then 1 grandbaby. And so that's kind of the history background, how we got to where we're at. My district is predominantly conservative. It's a Republican plus about 20 seat. And so it's a nice, safe Republican district, and again, represent Colonial Heights and Chesterfield County. So serve on education, which kind of works because I'm an educator, have a master's degree in education, educational specialist degree that goes beyond that post-master's degree. So it's what I do on the day-to-day job. And obviously education was a big part of Governor Youngkin's agenda. Being on the education committee is a place that I feel very comfortable working. I'm also in cities, counties, and towns, which oversees local government. And again, having served on city council certainly fits my skill set and understand how impactful a Dillon rule state can be for local government. Having to come to Richmond, ask those questions, ask permission many times to do certain things that aren't specifically codified. And so cities, counties, and towns is my second committee. And then my third committee, which I'm very grateful to have, is health, welfare, and institutions. And I say I'm grateful because I'm a lifelong learner. And quite bluntly, as a pastor, I don't know a lot about healthcare. I've been relatively healthy through my life. I don't interact with the healthcare system very often. And so it's been a wonderful learning experience to learn about the issues, to learn about the challenges that are facing healthcare today. And I think we're going to talk about some of those. And so I've really enjoyed the process of learning about what the issues are, what's important, and why it's impactful that we make the decisions we make here in Richmond. One of which I think we're going to talk about here in a minute is the staffing. But going beyond that, I'm going to talk about one of the things we helped pass this past year, which is safety and security protocols. There was the way the law was previously drafted. It protected medical professionals in an emergency room, but that care didn't extend to someone in an office setting. It didn't extend to the hospital beyond the emergency department. And so I think that was another place that we were able to come together to say health professionals need to be protected. Unfortunately, there's just kind of this degradation in society that people aren't respectful of one another. And if you go to, if a patient visits a medical facility and don't get the news they were hoping, or don't get the care they were hoping, they would become combative. They would become they would want to come after the medical professional that didn't give them the answer they thought. And so that was one of the things that I thought we really did well this past year, was extending that benefit to all medical professionals, no matter where they're at, to make sure that they're safe in their environments. As you say, Delegate Wampler did bring that this past session. I was supportive of that legislation. I did vote for that while in committee. And one of the reasons I supported that, because I went and talked to CRNAs. I was at a wedding, and a friend of mine is a nurse practitioner. And one of the young ladies she had gone to college with was a CRNA. And they had gone to college in North Carolina. So she had told me, she said, hey, go talk to my friend over there and get her perspective on that and see what she thinks about that. And my presumption was she was working in North Carolina because I knew that's where they had gone to school at. And so I went up and I kind of introduced myself, and I said, hey, the bride said I should come and talk to you, and you would tell me all about, what's going on. And she said, boy, will I tell you about what's going on. And so she launches in, and come to find out, she actually worked in Lynchburg. And so I wasn't getting cross state line information. I was actually getting Virginia specific information. And she was able to kind of tell me what the day-to-day really is like, and how often she sees a physician who's actually there, or one that's in the building versus one that's available, some other way. And as you state, the way the code is written, a podiatrist that has nothing to do with anesthesia is supervising someone administering anesthesia. And I'm sure doctors get some level of it while they're in medical school, but it's certainly not to the level of expertise that RNAs are given when they're in specialized training. And so that really, again, opened my eyes to what the real practical day-to-day operation is. Do we need that oversight? I know Governor Youngkin has made it a policy platform to reduce regulation, to get people out of the idea of burdensome government regulations. If my math is right, I think there's 43 states that do not require that. Why is Virginia one of 7? Why are we in such a minority state? We certainly don't see this huge malpractice of anesthesiologists in other states that aren't encumbered with the same thing. And I like to look at that way. Whenever, matter of fact, I believe when I was initially talking to your nurses about this, I said, tell me what it's like here, tell me like what it's somewhere else, and tell me the difference in instances of there being problems. And the answer was there's no difference. And so are we really adding anything by adding that extra layer? I don't think so, from everything that I've read, everything that I've seen. And so I do support that legislation. I do think it's a burdensome, onerous thing that everyone else has figured out how to get around it. Why can't we? Personally, I certainly think it would. Again, in talking to people that are within your community and that do the job that you do, I think there are choices that are made. If you can operate at full scope, or you can operate at partial scope of your skill set, you can make more money doing it at full scope. Why wouldn't you go do that? And where I currently reside, I'm in Colonial Heights, Virginia. I'm 45 minutes from North Carolina. That's within a normal commuting range for some people. And so if you can go 45 minutes south along that southern border, or someone in the northern tier of Virginia, and go into Maryland or go into West Virginia or go into some of these other states and make more money to do the same job, or to do even a higher scope of practice job, why wouldn't you do that? And so I do think we need to look at the regulations. I do think we need to make sure that we're giving our people that are graduating the best chance to stay here in Virginia. That's been one of our governor's hallmark call, is we want Virginia to be the best place to live, work, and raise a family. And are these regulations artificially stifling that? And I think it's certainly something we should be looking at. Absolutely. So here in the General Assembly, when I came in as a freshman, I was assigned a mentor by our caucus, by our Republican colleagues, and that was Delegate Roxanne Robinson. And so, I mean, you talk about someone who really understands healthcare issues as a former optometrist, literally, she sits right behind me on the HWI committee, so I can turn around at any moment and ask her questions. That has just been, what a wealth of knowledge, what an incredible understanding of how the legislative process works. So she was certainly very instrumental in understanding how it works down here, what to do, how to do, and how to navigate a very divided place with very partisan ideas on many things, and find consensus and common ground to make actually things work down here. Yeah, the only thing I'll encourage you guys with is advocacy works. Many times down here in Richmond, especially coming in as a new guy, you would hear people talk about the dirty word, the lobbyist, and how you don't want the lobbyist to control everything, or to have too much influence. I will tell you, as someone who has benefited greatly from an advocate coming down, and I'm not going to use a lobbyist word, I'm going to use advocate, from someone that comes down and helps me understand things that there's no way otherwise I could. I mentioned a moment ago that my mentor was Delegate Robinson, and she works in healthcare. Like, that's her life It's what she's done her whole life. I was in the military and I'm a pastor. Neither of those things lend itself to understanding the challenges in a healthcare environment. And yet, as a member of HWI, I will vote on those things. And many times, because of the way the committees are set up, my vote can be the deciding vote on whether a bill passes or fails. And if I don't understand appropriately what the issue is, what the outcomes are, what are the good and the bad, I can make a vote thinking I understand something and I don't. And so I appreciate the advocates like you that come to me and say, this is the bill. This is what the bill does. The good advocates will tell you what the other side's going to say. And they'll say, hey, they're going to come and tell you X, Y, and Z, and this is why that is correct or not correct, or why we think it offsets. And so I'll say that within your organization, I encourage your people to advocate and to get involved in the legislative process. Just like I don't know anything about healthcare, many of your people in your organization don't know anything about politics. And so they use your organization as a conduit, if you will, to get to me to tell me what's important to them. But really, again, I come back to that nurse that I spoke to at the wedding. The down to earth, the people that are doing it every day, they're the ones that move the needle on us understanding, us maybe voting a certain way, us changing a law, because we are able to talk to a real person who says, this is how this impacts me. So I want to encourage your organization to do the advocacy work, to get your members in your organization to reach out to the legislators, to talk to them, to come to Richmond. It's intimidating, I know, to come to Richmond, to come to the General Assembly building and to see what we do. But we're just regular people, and many times people think that we're smarter than they are, or that we are going to be intimidating to come down and speak with, or those kinds of things. But really, we're not. We just want to do the best things for Virginians. And from the either side of the aisle, we can have a different understanding or path to what that looks like. But if we don't know how it's impacting you on the day-to-day, we lose that sense of connection back to our constituents. And so that's what I'll encourage you guys is advocate your positions and encourage your members within the organization, not just to trust that the organization is going to do it, but the individuals need to take the time, effort, and energy to do that as well. It matters. It really does.